My name is Samia Mora. I'm from the Brigham and Women's Hospital and Harvard Medical School. I talked about HDL, particle number versus cholesterol. We discussed a little bit the HDL heterogeneity, how HDL particles differ by size, by density, by function, by a number of variables. And then we focused on looking at some of the specific epidemiologic studies. For example, we started out with the MESA study, the multi-ethnic study of atherosclerosis, where we examined about 6,000 multi-ethnic individuals and compared the number of HDL particles versus the cholesterol of the HDL. And we found that the HDL particle number was a more consistent association with both subclinical athero, measured by the carotid IMT, as well as with incident coronary heart disease events. So the summary from MESA was that the HDL number of particles seemed more consistent and better association with both subclinical athero and coronary heart disease, and that was especially true once you took into account the number of LDL particles and other atherogenic particles. Also talked about the Women's Health Study, which is a large 28,000 study, 28,000 women who had both HDL cholesterol, ApoA1, and the HDL particle number measured at baseline. They were followed for more than 11 years, and we found there that HDL cholesterol was inversely associated with events, as was ApoA1. But interestingly, the association weakened and became abolished when you look at the women who had a very low ApoB number, for example, ApoB less than 90 milligram per deciliter. And also in the Women's Health Study, HDL cholesterol seemed a bit better than the HDL particle number, so different from MESA, where we found out in the Women's Health Study that the number of HDL particles showed a weaker association with incident CHD. However, the large HDL in these women was very predictive of coronary heart disease risk. So it seems in these healthy women that the large HDL is very protective. And then finally, we tried to predict their HDL size and HDL particle number from looking at the HDL cholesterol and ApoA1 ratio. And we have several equations in a recent paper in clinical chemistry that depicts those associations, and we found that they predict well the HDL particle size and number. And then finally, touch briefly on Jupiter, which is a randomized controlled trial looking at rosuvastatin 20 milligrams versus placebo. And we'll look there at the on-treatment HDL cholesterol and ApoA1. And we found that on-treatment HDL cholesterol and ApoA1 showed a weak association with residual risk. However, HDL particle number shows a significant association, and that will be presented in circulation very soon.